Hey guys, this is Dr. Hub. Today we'll look at the vesiculobullous disorders. So under this, first we'll start with the pemphigus vulgaris. Pemphigus vulgaris. So the pemphigus vulgaris is a clinical manifestation. So what does it include? So there is a flaccid blisters. There's flaccid blisters. Next is denuded skin. There's presence of denuded skin. Then there is oropharyngeal, oromucosal lesions. There is oromucosal lesions are present. Then we look at the histology. So under histology, there is a acantholytic blister. There is acantholytic blisters which are present, and they are formed in the suprabasal layer of the epidermis. They are formed in the suprabasal layer, and this is of the epidermis. Next comes the IP, there is a immunopathology. So under the immunopathology, there is cell surface deposits. There are cell surface deposits, and what does it include? Here it includes the IgG, and this is on the keratinocytes fish neck pattern. So there are deposits of the IgG on keratinocytes, and how does it appear? It appears like a fishnet pattern. So what is the autoantigens which are associated with this? So the autoantigen associated here is the DSG3, then the DSG1, and this is in patients with skin involvement. Next we look at the pemphigus foliaceus. So the pemphigus foliaceus, the clinical first manifestation is that there are crust. And they are shallow erosions, and they are present on the scalp, present on the central face. Next, they are present on the upper chest as well. They are present in the upper chest and the back. Next, we'll move on to the histology. So how is the histology? So under histology, there is the acantholytic blisters. There's acantholytic blisters. So how are they? They are formed in the superficial layer. And this is of the epidermis. Next is, what is the immunopathology? The immunopathology is that the cell surface deposits of the IgG on keratinocytes. Then comes the AA. A stands for the autoantigens. So it includes the DSG1. Then we look at the bullous pemphigoid. So bullous pemphigoid, it is nothing but a large blisters on the, it's a large blister, and it is present on the flexor surfaces. So it is present on the flexor surfaces, and it is also present in the trunk. So what is the histology of the bullous pemphigoid? The histology is that it is a subepidermal blister. It is a subepidermal blister and with a eosinophil rich infiltrate. So it is a eosinophil rich infiltrate. Next, we move on to the immunopathology. So under immunopath, there is a linear band of the IgG or the C3. This is present in the epidermal BMZ. Next comes the autoantigens. So autoantigens, it includes the BPAG1 as well as the BPAG2. Then we move on to the dermatitis herpetiformis. Dermatitis herpetiformis. So under the dermatitis herpetiformis, the clinical feature is that it is extremely pruritic. It is extremely pruritic, small papules. Extremely pruritic small papules and vesicles. And this is present on the elbow. It can be present on the knee. It can be present on the buttocks as well as on the posterior neck. Next, we will look at the histology. Under histology, there is the subepidermal blister. It is a subepidermal blister. It is a subepidermal blister and it is with the neutrophils. It is with the neutrophils and it is in the dermal papillae. Dermal papillae. Next is we move on to the immunopathology. Under immunopathology, it is a granular deposit. It is granular deposits. This is of the IgA, granular deposits of the IgA, and at the tip of the dermal papillae. This is at tip of the dermal papillae. Next, we move on to the autoantigen. So autoantigen, it contains the epidermal. There is epidermal transglutaminase. So there is epidermal transglutaminase. Next, we move on to the linear IgA disease. Linear IgA disease. So what is special in this? It is nothing but the feature is the pruritic. There is pruritic small papules. There are pruritic small papules. It is present on the extensor surface and it is occasionally larger. It is occasionally larger, and there are presence of the arciform blisters. So there are presence of the arciform blisters. Then when we look at the histopath, under histopath it includes the subepidermal blister. There is subepidermal blister and this is with the neutrophil. This is with the neutrophil infiltrates Next, when we move on to the immunopath, there is a linear band of IgA. There is a linear band of the IgA, and this is in the epidermal BMZ. Epidermal BMZ. So what is the autoantigen which is associated here? The autoantigen is nothing but the BPAG2. Lastly, we move on to the epidermal lysis bullosa acquisita. So what is special here? So here the feature is there is a tense bullae. It's a tense bullae, and there are also presence of the erosions, and there is a subepidermal blister. There is presence of subepidermal blister. And when we look at the immunopathology, there is the IgG and the C3, DEJ, and continuous and it's linear. This continuous and linear. Lastly, we move on to the section of the autoantigen. So here the autoantigen, that is the type 7 collagen. It is a type 7 collagen. So this was about the vesiculobullous disorders. We saw various diseases, and we also saw the clinical manifestation, histology, immunopathology, as well as the autoantigens. To learn and grow daily like this, please do subscribe.